Hi, this is Brian with Can Do MS, and welcome to our COVID-19 update. This panel that you're about to see did a video for us back in March answering some of your questions about the coronavirus epidemic and how that may impact your multiple sclerosis. The panel is back to answer some more questions as the COVID-19 situation moves into a different phase over this summer. Please enjoy with our esteemed panel, Kalb, a clinical psychologist, Kathy Costello, a nurse practitioner, and Mandy, Rohrig, a physical therapist. Please enjoy.
I want to start by asking Kathy, our nurse practitioner, a question. When we first got together several weeks ago, we talked about the beginning of data collection around people with MS and their risk of getting COVID, and then what happens if they do contract it. So, Kathy, can you fill us in on what has been happening with that database?
So the National MS Society collaborated with the Consortium of MS Centers and also the MS Society of Canada to put together a database that was driven by healthcare providers in MS. So what this meant was that healthcare providers who were caring for people with MS, and some of those patients got COVID, and they were asked to enter the data about that particular, what's called a case, into the database. And so they were asked to wait until the outcome of the case was pretty well known, and then enter that data in. And it's a large amount of data. It includes things like someone's age, their sex, the type of MS that they have. Are they able to walk? Were they on a disease-modifying therapy? Were they mildly ill with COVID, or were they seriously ill? And then ultimately, what was the outcome? And the reason to do this is to understand what's happening. This is a novel virus. It had never before been seen in humans, and certainly no humans who had MS. And so we have no idea the actual impact of this virus on people with MS. The only way to learn that is to look at the data. And it's unfortunate because we'd really like to know ahead of time what to do and what to expect. But the only way to gather that is to have a data collection method. And that's why this was put together. And the good news is that this data collection is harmonized to some extent with other data collections that are going on across the world. The MS International Federation is managing data collection, and the Italian Neurological Society has also put together a large database, and we're trying to look at these data together so that we can more quickly learn what the impact of COVID is on people with MS. When we look at this database, some things do emerge, and this has also emerged in some of these other data collections. And so one of the things is that people with MS itself are not at increased risk. However, there are some characteristics about someone's MS that may place them at greater risk for a more difficult course of infection should they become infected with the SARS-CoV-2 virus. So, for instance, older age, more progressed MS, more difficulty with ambulation, particularly if someone is non-ambulatory. Ambulatory restricted in any way or non-ambulatory, these are additional risk factors to the risk factors that we already know in the general population, which would be older age, and then comorbid conditions like cardiovascular disease, hypertension, diabetes, obesity. Those types of things are a risk factor for anyone. And then people with MS who have more progressed disease, are older, have had MS longer, and are ambulatory impaired. Those are additional risk factors. At this point in time, there's very little we can say about disease-modifying therapies. And I know that's a big question that everyone has had. Should I stay on my therapy? Should I change? And the basic message is that in general, people should stay on their disease-modifying therapy. However, they should have a conversation with their MS provider to talk about what are the possible risks that may exist for them. Again, given some of their own personal risk factors, Are there any additional risks if someone's on a particular type of disease modifying therapy? And that's a very individualized decision that needs to be made.
Sure. And should we say anything at this point about smoking as an additional risk factor? We know that it's a risk factor for so many things, but are there any data related to that in COVID?
Yeah, I mean, I think that for active smokers, that has been identified as a risk factor because it does provoke lung compromise. And this is a lung virus. This attacks the lung directly. It has other effects on vasculature as well. But when you have a virus that attacks the lungs, anything that compromises lung function is really going to provoke a more serious infection course. So smokers, without a doubt. People that have obstructive lung disease called COPD, people with emphysema, uncontrolled asthma, people that have restrictions in their mobility that in fact may compromise their ability to breathe fully. All of these things are going to be risk factors once someone would become infected. Their course of their infection could become much more serious.
So are there any particular things from a nursing perspective that you would like to recommend to our listeners?
Yeah, so I think that people are concerned, and we have heard this at the National MS Society when we've asked people, some of their greatest concerns are their risk of getting this infection. And honestly, it's everybody's concern, to be honest. But when you have a chronic condition, that there's going to be increased worry. So reducing transmission of the virus is really important. And to do that, and people have heard these things, but I can't stress enough how important they are. People really should wear masks when they're out and about, not only to protect themselves, but you're doing something for someone else. And even if that other person looks perfectly fine, what if they're taking care of an elderly family member, or they have a child who's immunocompromised? You're doing something to protect those people too. So not only yourself, but others. And it really does work. There have been studies looking at how much droplet transmission is reduced just by wearing a simple mask. And I have to say, the mask really does need to cover your nose and your mouth. Wearing it around your neck or wearing it just over your mouth is probably not going to be okay. So wearing that mask over the nose and mouth is really what people need to do. Hand washing. Can't stress it enough. Top 10 reasons for transmission of anything are right here. And so when you wash your hands frequently and then try not to touch your face afterwards, it's really very, very important. Keeping that social distance. It's become just part of what we say now, right? I invited a friend to take a walk with me and I said, with social distance, of course. But that's really important because when you cough, sneeze, and even speak, there's a distance that those droplets will carry. And we want to reduce your chance of getting that. And avoiding groups, right? You just don't want to gather in large groups. And people often ask me, well, what about my spouse or my partner or my friend who works, they're healthcare workers? Should I avoid them? Should I stop my disease modifying therapy because they might bring something into the home? No, you should not stop your disease modifying therapy. But I think we all have to be vigilant. And if you're in that situation, it probably means that you have to have more vigilance, right? So you really need to be more careful. So when that person comes home, making sure that they take those icky hospital shoes off before they come in the house and they wash their clothes and wash their hands, which may seem tedious and a lot to do. But I think that following these kinds of steps reduces the transmission and it reduces the amount of virus, right? So a lot of what drives people getting sick is the load of virus that they actually get. So we can minimize that and reduce the chances that more people become infected. This is not the flu, okay? So anything people have heard that, oh, hey, this is just like the flu. No, it is not. More people have died. There are more people with serious illness. And we all need to do our part to really reduce transmission. Because guess what? If we don't, our healthcare system will be overwhelmed and choices will be forced upon us that nobody wants to make. And we need to keep that curve as flat as possible and reduce people from getting this infection.
COVID, as Kathy has suggested, and Roz has too in the previous conversation, can impact the lungs quite significantly. So one of the things that we can do is to try to optimize our lung capacity and try to make our breathing and our breaths as strong as possible. And we can do that through diaphragmatic breathing or deep breathing exercises, where you practice breathing in through your nose and allowing your lungs to fill kind of an outward like a balloon, and then exhaling slowly like you're blowing out a candle through your mouth. And that allows that lung capacity to fill up as much as it can, and then slowly release that from the lungs. So practicing those deep breathing exercises is something you can do right now, all of us can do right now, in order to, again, hedge our bets if and when this may happen. Similarly, I think it's important to think about our posture. Many of us are spending our days on our computers, right? Whether or not we are ambulatory or use a wheelchair for mobility. But this forward head, forward shoulders, rounded shoulders posture, it's really hard to take good deep breaths when you're in that position. So thinking about opening that chest up, stretching our pec muscles or our chest muscles, as well as doing some nice shoulder blade squeezes, can be nice ways to keep our posture optimal that allows us to take those good deep breaths that we spoke about. So things we can do right now, it's important. So Roz, I'd like to ask you a question now, because I think it's quite interesting that as things are starting to reopen, that there's a lot of variability in opinions and approaches to reopening. So how would you suggest that people communicate or manage all of these different feelings and fears about reopening to close friends, loved ones, acquaintances, especially when people have different approaches and strategies?
I actually think that's kind of the key question right now, because I think those conversations are going on in every household across the country, across the world, whether or not anybody in the household is living with MS. And I think it's like any other issue we deal with our loved ones, where we don't necessarily see eye to eye, or we don't necessarily have the same tolerance for risk, or we don't necessarily see the same risks in the world around us. And I think the key is to talk to your healthcare providers if you have MS and find out what the recommendations are for you in particular. Then I think it's having a conversation first with the people in your own house about any strategies you can use to mitigate the risk of contact with people outside your house who may increase your risk. So as Kathy was talking about, if somebody is coming into your house from a job, from the grocery store, from the street, from anywhere, you talk proactively about how are we going to handle people coming in and out of the house. And then I think you also need to talk to friends and neighbors who may not appreciate the level of your concern as a person living with MS, or a support partner of a person living with MS, so that they understand why you're taking the precautions you're taking, that it's not about not wanting to see them, not caring about how they are. It's just about finding ways to gather that reduce your anxiety and limit your risk. I think all of these conversations need to be done calmly and matter-of-factly. But then I think it's really important to stick to your guns. Once you as a family have decided, after debate and conversation and kind of going at it until you reach your decisions about how you're going to do it as a family, that then you stick to that with other people. And I think, Mandy, that you've had some pretty profound experiences around this. Would you mind sharing? It's not anything to do with COVID or MS, but if you would share a similar situation that your family had.
Yeah, and actually how you were talking about that, Roz, really reminded me of our situation. So my daughter is a liver transplant recipient. She received her transplant when she was 16 days old. So she was quite young. We were all extremely terrified and very cautious given her significantly suppressed immune system right after transplant, and then certainly when we got home. We almost developed a bit of a protocol for the people who were in our inner circle. So immediate family was in our inner circle, and a few grandparents. But that was it. We communicated very clearly, maybe a little bit neurotically, what those criteria were. But the expectations were high. The expectations that were, if you were going to come to our home, that you were showered, that you wore clean clothes, that you wore a mask, and you wore gloves. These expectations were laid out very clearly for our loved ones. And we also said that if there's any deviation from this, if you're sick, you're not feeling well, you were around somebody who was sick or wasn't feeling well, that you let us know. And it wasn't a check mark against your name or anything. It was just a way for us all to work together to keep the most vulnerable person in our family as safe as possible. So just to echo your comments, Roz, honesty, communication, that's how this can be successfully managed. So I do think that it's very important to always remember that communication can solve a lot of challenges for people and for families and those that you love.
And like the situation with COVID today, I'm sure that your situation with your daughter went on for quite some time. If it started when she was only a few days old, you had to be very, very careful for a very long time. Did you find that people over time were getting more casual or didn't understand why you were still enforcing these regulations? What happened? Did you get any pushback?
Yeah, so her immune system was significantly suppressed at the point right after transplant, and then gradually she was allowed to have more of an immune system the further away that she got. But truly for that first year, we were definitely in our little bubble, in our circle. I think how I handled it, and this doesn't mean that it works for all of you out there, but how we handled it and how I handled it as a family is I just said that this is what we are comfortable with. This is what our family is comfortable with. You are entitled to approach it in your way, but these are the expectations for our household. And if people relax, I gently reminded them by either not an invitation to our home or just gently reminded them in the moment that these things are really important to us and they're for the safety of our daughters.
So I think this is the really the best advice we can offer all of you. You sort this out in your own family, and it may take you some time to sort that out and come to agreement about what you as a family believe and can tolerate and feel safe doing. And then as a team, you then communicate that with other people around you, some of whom will understand it better than others, some of whom will agree, others who won't, but it doesn't matter. What matters is that you as a family have set your priorities and work to communicate them as clearly as possible to those around you. And if we all do as Kathy has mentioned, and we follow the rules, maybe we can help end this sooner rather than later.